I read this op-ed in the Wall Street Journal by Michael Steele, chairman of the Republican Party. And in that op-ed, he says, I'm against government health care. Government health care is really, really bad. We don't need government health care. But what we need is to protect Medicare. Right? And of course, he goes on a radio show on NPR, and they rip him to shreds because Medicare is. But he won't come out and say Medicare is a bad idea because they're old people who are suffering, and we can't afford to let them just fend for themselves. Now, granted, Medicare is this wheel in politics that you're not supposed to touch. But underline that, why aren't you supposed to touch it? Because, again, there's this philosophy, there's this idea that need is the standard. And if we need to sacrifice doctors to this need, well, doctors make a lot of money. They're educated. They can take care of themselves. Why worry about them? If we need to sacrifice the wealthy, those evil wealthy who made $250,000 or more, then that's okay because they've got a lot of money. They don't need that money, right? And these people really do need it. So it's okay. And again, Republicans are not going to stand up against this. If we have to sacrifice those people who don't have existing conditions for those who do have existing conditions, that's okay. Because that's what happens, right? If we cover existing conditions, what happens? Everybody's insurance policy prices go up. They have to, because the cost of the insurance company is going to go up. They have to make it up some way. They have to bill somebody who doesn't have pre-existing conditions. They have to bill him more. But that's okay because he doesn't have pre-existing conditions. He's healthy. So it's okay for him to sacrifice to those who are not healthy, who need the policy. And after all, is sacrifice a bad thing? Sacrifice is a good thing. Our mothers taught us sacrificing to strangers is a virtue. Right? We vilify the profit motive. And this is the flip side of the same kind of morality. A morality that tells us that need is the standard. And sacrifice is demanded of us. And sacrifice is a virtue. Sacrifice is the standard of virtue. The more you sacrifice, the better you are from an ethical perspective. The flip side of that is what? If you're selfish, that's evil. That's bad. Don't think of yourself first. Think of yourself last. Be selfless, right? And what are profit-seeking drug companies doing? They're thinking of themselves first. They're trying to make money off of sick people. That's evil. What are doctors about? What happened to this, altruistic doctor? Shouldn't you be offering all these treatments for free? I can't afford it. They're out to make money, and they're pretty wealthy. If you look at the statistics, doctors are they're the rich, $250,000 or more. So it's easy to vilify the profit motive in this kind of ethical culture in which self-interest is viewed as evil, as bad, because there's no question profit is about self-interest. Drug companies about self-interest. And the easiest one to vilify are insurance companies. I think one of the most disgraceful, horrific things that's happening right now is the way insurance companies are being vilified. Here are companies that serve all of us, all provide us a crucial part of what it takes to get good health care, and they are presented as the devil incarnate. Why? Because they dare make money off of the service that they provide us. And I haven't seen anybody, and this pre-existing condition is a great example of that. They dare not to insure somebody who's already got a disease. Well, that's why they're an insurance company, not a welfare company. Insurance companies don't insure you if they know you're going to have an accident, right? If they somehow knew that you were going to have an accident, you couldn't get auto insurance. If they knew that you were living on the fault that is going to have the earthquake a year from now, they wouldn't give you earthquake insurance. And if they did, they wouldn't be an insurance company. They'd just be an agency for redistribution of wealth. But nobody is going to stand up and speak out against this notion because the people with pre-existing condition need health care. And that's the standard. As long as we hold need as the standard of morality, as long as we hold sacrifice as a virtue, there is no way to fight socialized medicine as there is no way to fight socialized anything. Socialism is consistent with this morality. Egalitarianism is consistent. We sacrifice those who have for those who don't. That's the whole notion of socialism and fascism and totalitarianism generally. But, you can't argue against that from within that ethical system. That is completely ethical based on this philosophy. So I want to suggest that long term, if we're going to win this battle, we need to reject the philosophy of self-sacrifice. We need to reject the morality of need or the morality of altruism, which is otherism, the placing of others' well-being above oneself. And we need a new morality. We need a moral revolution. And only a moral revolution can save capitalism, can save free market health care, can save, banker salaries these days. Only a moral revolution that says no. Morality is not about what's good for others, but morality predominantly is about taking care of self. Morality is about life. It's about living. It's about finding those values and virtues that are required for individual human life and individual human success. Profit under such a morality is a virtue. Drug companies are heroic for doing what they do and making the money that they do, and shouldn't apologize for a cent of it. Because how do you make money in a capitalist society? By providing value through win-win situation. We're all better off from other people making money because we're all trying to make our lives better off as well. This is a morality that says that your life is the standard, that your moral responsibility is not for those in need, but your moral responsibility is to pursue your own life, to pursue your own happiness, linking up to John Lewis's reference to the Declaration of Independence. That's the political principles on which this country was founded. What we need is a morality that justifies those principles, that says it's okay to pursue your own happiness. It's right to pursue your own happiness. It's moral to pursue your own happiness. Because a system in which we all view the pursuit of our own happiness as moral, the pursuit of our own life as moral, long-term, rational, is a morality that says, leave people free to do so. Leave people free to find the best health care that they want. Leave people free to make mistakes. Some of us will go to the witch doctor and try to cure cancer with witch doctor. But we have a right to do that. We should have a right to try experimental drugs. We should have a right to really personalize our medicine. Personalization of medicine is ultimately about, it's not just a new thing, it's an old thing. It's about making choices about what's good for me. But that should be the moral imperative. Making choices about what's good for me should be our moral standard. Now, I'm trying to introduce a new moral theory in like 2 minutes. So I'll encourage you all to go and read Ayn Rand, because I think this is a real revolution. I think this is what's really exciting about her writing, because I think that capitalism and freedom long-term are going to depend on these moral ideas getting out there. So if we're going to save healthcare, and I encourage the short-term battle in defeating this bill, I'm all with it, and we at the Institute will do whatever we can to defeat it, but the long-term battle is a much more difficult battle, a much deeper battle, and I really believe is going to require this kind of moral revolution, and I encourage you all to join me in that battle. Thank you all.
Thank you, Yaron.